Hey everyone, this is Dexter with HNC Let's Talk Podcast. It has been a while since we touched base. Today's we're going to talk about something that's very important because we're changing our format to focus more or less on the insurance industry. As a broker and an agency, we want to make sure everyone is aware of all the changes that are going on within the marketplace as well as Medicare. Today, we're going to talk about Medicare Part B premiums. So before we get started, there's a lot going on. So enjoy this show. And again, let's get started.
You're listening to the HNC Let's Talk podcast, hosted by Dexter Brooks. Thanks for tuning in to HNC Let's Talk podcast. We partner with subject matter experts to provide candid conversations on health and lifestyle. Here at HNC Let's Talk podcast, mental, physical, spiritual, financial, and health are all connected. This episode of HNC Let's Talk podcast is sponsored by HealthNet Co. Together, we make insurance simple.
Okay, we are back. As I was saying, today's topic is going to be about Medicare Part B. CMS just released new information for Medicare Part B premium. Basically, it's going to increase for 2022 to the largest ever. Medicare's Part B monthly premium for 2022 will increase by $26.60, the largest dollar increase in the health insurance program's history. The Center for Medicare and Medicaid Services, CMS, announced on November 12th standard monthly premiums for Part B will cost $170.10 in 2022. That's up from $148.50. That's $148.50 in 2021. Medicare's Part B covers doctor's visits and other outpatient services, such as labs, tests, diagnostic screenings. CMS officials gave three reasons for the historically high premium increase. One, rising prices to deliver health care to Medicare enrollees and increased use of the healthcare system. Some of the highest healthcare spending is being attributed to COVID-19 care. In 2021, this is number two, because of the pandemic, Congress took action to significantly lower the expected Part B premium increase for that year. In 2021, the Part B premium increased only $3 a month. Congress directed CMS to pay back that reduced premium over time, and that a payback is starting in 2022. Number three, CMS is setting aside money in its reserves in the event it decides that Medicare will cover a new medication, a new drug called Aduhelm, a new Alzheimer's drug that was approved by the U.S. Food and Drug Administration, which is FDA, earlier this year. CMS is still looking at an analysis to determine whether Medicare will cover Aduhelm and how and any similar drugs to treat Alzheimer's. CMS officials said the fact that they are setting aside money to cover the use of that drug is in no way implies what the coverage determination will be, but that they have to plan for the possibility that Medicare will cover the high-cost drug whose price has been estimated at a whopping $56,000 a year. Wow, that's a lot. Moving on, CMS officials stressed that while the 14.5% Part B premium increase is a stiff one, the Social Security cost of living adjustment, which is COLA, will increase to 5.9%. Excuse me. That's the largest in the 30 years and is estimated to average $71.40 per beneficiary. So even after the increase in the Medicare Part B premium, most Social Security recipients who Part B premiums are typically deducted from their Social Security benefits will still see a net increase in their monthly check. The COLA goes into effect in January. Now, just think about that. Here we are looking at a tremendous increase, the largest in history on Part B. Premiums for some Medicare enrollees will be higher than the standard because these monthly payments are based on income. Part B beneficiaries with annual income greater than $91,000 will pay more. How much more would depend upon income? For example, someone filing an individual tax return whose income is between $91,000 and $114,000 will pay $238.10 a month for Part B. CMS says about 7% of Medicare beneficiaries will have to pay more than the standard monthly premium. Most Medicare enrollees must pay Part B premiums whether they have original Medicare or Medicare Advantage plan. Some Advantage plans offers what is called so-called give back benefits, where the plan covers part or all a member's Part B monthly premium. Consumers can contact their broker or reach out to HNC Medicare Insurance Direct. There's other things that are on the rise as well. Other Medicare charges also rising. The annual Part B deductible will rise $30 next year to $233. That's up from this year's $203. For Medicare Part A, which covers hospitalization and some nursing homes and home health care services, the inpatient deductible that patient must pay for each hospital admission will increase by $72 in 2022 to $1,556. That's up from $1,484 this year. Almost all Medicare beneficiaries, 99%, pay no Part A premium. Only people who have not worked long enough to pay their share of Medicare taxes are liable for Part A premiums. As you all know, open enrollment for Medicare began on October the 15th and continues through December the 7th. During this period, beneficiaries can review their coverage and decide whether to make changes. Beneficiaries can speak with their local broker or contact HNC Medicare Insurance Direct. So let's go ahead and decipher that a little bit here. So this is where the key points are. Number one, Part B monthly premium for 2022 will increase by $26.60. So the new cost for 2022 will be $170.10. The cost as of today in 2021 to the end of the year is $148.50. So when we look at that amount, we need to make sure seniors beneficiaries are definitely looking at other plans so that they are receiving the best benefits that they can, because it's important that when open enrollment, which is now ongoing in full swing, that they go in and do what we call a plan assessment. We want them to review their current health conditions and the needs for their plans. Because when they go in to do a health assessment through their benefits, they more than likely will find a plan that better fits their needs. So it's very important that everyone take a moment, reach out to your grandmother, your mother, your friends, your neighbors, anyone that's currently on Medicare who is receiving Social Security benefits, have retired, that they now go and shop for a plan. Because when it comes to the Part B premium being up to $170.10, that's an impact on a lot of seniors. However, there's some good news into this thing as well, because as we say, the good news is that there's also the increase in COLA. So COLA isn't being increased for the first time in the largest in 30 years, at 5.9%. So that's an average estimate of $71.40 per beneficiary. However, when you subtract that $71.40 from the increase in Part B, you might see about $50 net in your check, but that's pretty good for seniors, and we need to make sure our seniors are receiving all the benefits that they can. Again, this is very important because our seniors are the leaders. They're the ones that built our country. They're the ones who stood the ground and made sure that every one of us are here today and receiving the benefits that we need to receive. If you want to learn more about these changes, you can visit us online at HNC Medicare Insurance Direct. Our website is hncmedicare.com. Or you can contact us at 1-833-444-4139. And you can also speak with one of our agents here to assist you with your health plan assessment and your Medicare enrollment. This is Dexter with HNC Let's Talk Podcast. I hope everyone is healthy, well, and having a great 2021. Until our next podcast, have a great one.
You're listening to the HNC Let's Talk podcast, hosted by Dexter Brooks. Thanks for tuning in to HNC Let's Talk podcast. We partner with subject matter experts to provide candid conversations on health and lifestyle. Here at HNC Let's Talk podcast, mental, physical, spiritual, financial, and health are all connected. This episode of HNC Let's Talk podcast is sponsored by Health Net Co. Together, we make insurance simple.